All my systems shut down. Zoom shut down, the computer shut down, everything shut down. I've had to start from scratch. But I believe God is good, and we should finish it in time for the Sabbath school. So say a prayer for me. Okay, so you should be able to see what's coming up now. All right, let us begin with a word of prayer. Let us begin. Father, we thank you for this time we spent together, and we invite your presence to be with us as we present this important subject this morning for Christ's sake. Amen. All right, I'm going to go straight in to the lecture now. It is one of those things today, but never mind. See what happens. So the subject that we're going to cover, all right, here we go. What everyone needs to know about bowel cancer. Now that is very important. What everyone needs to know about bowel cancer. So let us go straight into it. So when you're dealing with cancer, or colorectal cancer is sometimes referred to, it's cancer affecting the bowel. The bowel is made up of the colon. You see the three parts of the colon there, which sometimes called the large intestines, made up of an ascending, transverse, descending, sigmoid, and rectum. So anything along that corridor of tube can be affected by cancer. Cancer is an abnormal growth that occurs in the epithelial cells or lining of the bowel. Now, we're producing cancer all the time. It's just that your body deals with it. So it's not that we don't produce cancer. Everybody's producing cancer. As you sit, as you eat, as you breathe, we're producing cancer. But there are times or things that happens that cancer goes out of control. The immune system does not recognize it, and then the overt disease presents itself. Now, why is this an important subject for us all, men and women? But men day today is the main male day. It is the third most commonly diagnosed cancer in Australia. So that's pretty high. Anybody knows what's the cancer most diagnosed other than bowel? Lung cancer. So that reflects people's habits. Now, when you look at the number of people diagnosed, 15,531 Australians diagnosed with cancer each year, about 300 a week, and about 1,716 of them are below 50. So do not get the impression that this is a disease of elderly. It's not. There is a very high diagnosis between 40 and 55, very high diagnosis. And it's certainly worth looking at. If you're a young person, you really need to pay attention to this issue here for sure. And it claims about 5,350 lives every year, about 103 people a week, including 315 under the age of 50. So this is not an old man's disease in any measure at all. It's a very common disease, and it's the one that's neglected the most because we don't see it. And when you don't see something, by the time you pick up onto it, it's gone too late. So let's look at the death rate. So when you're looking at the cancer mortality in Australia, you'll see lung cancer is number one, colorectal cancer is number two. So colorectal cancer or bowel cancer, colorectal is just another name for the bowel. Colorectal cancer, the death is higher than breast cancer, cervical cancer, prostate cancer, all brain cancer, all the things that are very popular and sexy to talk about. Bowel cancer, the death rate and incidence is higher than all of those. So it's one of those things that it's almost silent. It's not being paid particular attention to, but it actually causes a bigger problem than the things that we hear lots about: breast cancer, cervical cancer, prostate, all the big things you hear on the news. Turns out bowel cancer causes more problems than all of those, but yet we don't hear too much. There's a resurgence of interest in it now, but it certainly is not. It's not headline news right now. So when you're looking at the incidence, it's 1 in 15. Isn't that a scary thought? 1 in 15 people are getting bowel cancer. It's a very, very high incidence. And if you look at the death rate, it's the second deadliest cancer, lung cancer being the top, bowel being the second, and of course prostate in men. and prostate the third, the three most common cancers around. So we are dealing with a very big problem here that to a large degree is being ignored, large degree. And you'll see why in a minute. About 50% of people diagnosed with bowel cancer are male, and about 46% are female. So there's a greater preponderance on men, but statistically probably not much different, but there's a certainly high incidence of prostate cancer among men. And the advice really is we should be screening from about age 45 for disease, because there is an occurrence between 40 and 55 that is being missed. So by the time you hit about 40, 45, you ought to start screening for it. So what causes it? What causes this thing called bowel cancer? Well, it originates, as we said, from the lining cells of the bowel. Sometimes that cancer, therefore, is called an adenocarcinoma. It's a cancer coming from the lining of the bowels itself. And there are other rare causes like lymphomas, carcinoid sarcomas, which can cause it. But the common one is just this epithelial lining, the lining of the bowel. And that's what it looks like there. It develops as a result of that mucosa lining. If you look on the right side, the stage note is just a little bit of a polyp. And if it's not addressed, if it's not picked up or diagnosed, it gets larger and larger to stage 2, stage 3, stage 4. When it starts breaking through the outer wall. Just take that off for me. Just put a dot on the arrow there. Just take off the virus, so it doesn't affect us here. So stage 1, stage 2, stage 3, and stage 4. And yes, just on the top there. Thanks so much. Perfect. Thanks. Yeah, and it becomes invasive. And by the time it becomes invasive, it starts spreading. Can you close that door for me? It starts spreading and then becomes a problem. So the thing about it is, when you get a cancer doesn't just show up yesterday. I got cancer yesterday. It doesn't happen that way. It takes about 10 years from the time you have changes in the epithelial cell to the time it presents as cancer. So by the time, if you pick up cancer today, it has been with you for at least 10 years in terms of its etiology. And it normally occurs to adenocarcinomas from an adenoma, where 10% of adenomas, benign tumors or polyps. And certain genes, if you have a certain predisposition to polyposis coli or hereditary non-polyposis colorectal cancer, yes, you can get it. You might ask them just to quiet down a little bit, it'll come through the mic. So what are the risk factors? Now here is where things become serious, because you need to know the risk factors. Now, about 75% of colorectal cancers are sporadic. In other words, we don't know why it happens. That's all it means. There are risk factors, we just don't know why. We don't know why it's occurring. But there are some other risk factors that are called, these are non-modifiable. Non-modifiable means to say there's nothing we can do about it. It just happens because of what happens in life. So for example, age, you can't influence that. There's a high incidence of cancer, bowel cancer, as you get older. It may be that there are predisposing situations around, but the point is we can't influence that. There is associated family history. So if there's cancer in your family, there's a chance that there's a genetic link. There are mutations that occur, and if you have a condition of inflammatory bowel disease, such as Crohn's disease, ulcerative colitis in particular, you can mutate very quickly, not quickly, but you can mutate some people to cancer. So those are non-modifiable, nothing we can do about it. However, there are some risk factors which are modifiable. Now, this is the point I wanted to make. This is a non-modifiable one, but it's an age factor. It is strongly associated with age. The older you get, the higher the incidence of all cancers, but it can occur in persons as young as 20. That's a scary thought, isn't it? So all these young men who are here, it can occur. Not common, but it can occur. And certainly once you hit out in the 40s, then you start looking at a high incidence of cancer. So it is one of those things that you can't neglect, but you can make some changes. So we saw about the non-modifiable one, the age and inflammatory bowel disease, genetic links and family links and so on. Here are some things that we know are linked to cancer, bowel cancer, which you can change, you have influence over. One of them is alcohol. So it increases the risk if you drink more than 2 alcoholic drinks per day. That's not a lot, is it? 2 beers, somebody says, well, I drink 2 beers and 2 beers a day. Well, you've just increased your risk pretty significantly. So just alcohol by itself. No wonder the Bible says wine is a mocker, strong drink is raging, and whosoever is deceived thereby is not wise. So alcohol, a big risk in it. The other one is obesity, being fat. So it increases markedly with fatness, with body fatness. And how you determine your weight is your BMI. The most significant part of your body to measure your BMI is your abdomen. It's your waist-hip diameter. There, that girth between your waist and your hip. That is what is your best indicator of body fatness, obesity, and therefore increased risk of cancer. It's bowel cancer specifically, but general cancers as well. Here's another one, physical activity or physical inactivity. So people who have recreational activity reduces cancer risk by 16%. And the more fit you are, the more engaged you are, the lower the incidence of bowel cancer. Of course, if you spend your time watching Netflix all day, there is a high chance you will increase your risk of bowel cancer. So again, modifiable, you could change that. It can be done. This is an interesting one. Meats, red meats and processed meats. Now, you know, what's like processed meats would be like what? What do you call it? Like sausage or hamburgers or, you know, those things we buy in packs. Red meat and processed meat, eating too much red meat, beef, lamb, pork, goat, has been linked with an increased risk of bowel cancer. How much do you think you need to eat to be in trouble? How much meat do you think you need to eat in a day or a week? Any thoughts? But no, what? Yeah, but to increase your risk. You'd see, eating meats, processed meats such as bacon, ham, salami, sausages, strongly linked to bowel cancer. So it's not a good idea buying those things in the supermarket. They're strongly linked to bowel cancer. And the answer to that is, I have it on another slide, is if you're eating more than 3 meat meals per week, your risk of cancer is increased, so significantly. Smoking, here's another one, smoking. So if you smoke 40 cigarettes or 2 packs per day, increase the risk of bowel cancer by 40%, double the risk of bowel cancer death. So smoking just has a big impact on your bowel cancer risk. Red and processed meat, we talked about. If you eat red meat, you should limit it to no more than 3 portions per week. So 3 times a week. And it should be less than 300 to 350 grams of cooked weight. So that's not a lot, is it? But that's what the factors are. Particularly if you're taking barbecuing or cooked meats with oven or grilled meats, the increased risk of bowel cancer is very high. So barbecue is actually considered. Did you know that barbecue, according to the Centers for Disease Control, barbecued meats are considered a cancer risk, cancer-causing substance. Barbecuing. So when you grill your meat or barbecue your meat, according to the cancer people, you have just eaten a carcinogen. You've eaten something that can cause cancer. So temperature lows, marinades are presented. I'm not suggesting you should eat meat. I'm just saying the risk is there. But eat little or no processed meat is probably the best answer for all sorts. And certainly avoiding red meat would be a good plan. So because you are what you eat. Yes? You are what you eat. So being careful about how we choose and what we eat is very important. So whole grain, plant-based diet and with dietary fiber, turns out that these are what are protective to us. The whole grains, fiber contained in food decreases your risk of bowel cancer. And eating at least 90 grams of whole grains a day, brown rice, whole meals, and so on, will reduce your risk of bowel cancer by 17%. So these are significant numbers. These are significant numbers. But it does tell you what is a better plan than what we're doing now. So a plant-based diet might be a safer subject. Research certainly suggests that more than 2/3 of your plate should be whole grains, vegetables, beans, fruits, and nuts. You probably, I didn't say a vegetarian diet. Did you notice I did not say a vegetarian diet? I said a plant-based diet. What a vegetarian diet could be a lot of things. So if you ate potato chips and ice cream, what is that? That's a vegetarian diet. There's no meat. But I say there's a big difference between a plant-based diet and a diet that has no meat in it. So no meat means you take the meat out. Pizza, is that vegetarian? Well, I mean, a normal vegetarian pizza is pizza, but it's not plant-based. Potato chips, all of those are plant-based. They're not plant-based. So plant-based diet are whole food diets that are high in fiber and so on. Now, here's another modifiable risk factor, removing the polyps when they come up. So I'll show about how do you pick that up as well. They're modifiable risk factors. So people who do bowel cancer screening have about a 40% less chance of dying from bowel cancer because you pick up the problem before it spreads. That makes sense? You pick up the problem before it spreads. So that should be all right, I think. That should be okay. We'll just leave that. Yep, thank you. Perfect. Well done. So the importance of screening comes up. Removal of polyps before they become cancerous is the way forward. So that's a modifiable risk factor. That's a polyp, a little polyp that appears is not cancerous as yet. If you remove it before it becomes cancerous, you remove the risk of cancer. Here are some others that are interesting. It certainly suggests that the calcium and calcium supplements they will decrease your risk of bowel cancer. But I think you're looking more at things like yogurts rather than milk. Consuming 400 grams of dairy products decreases your risk by 15%. Consumption of 200 grams of milk or dairy-associated calcium decreases it by 6%. Got to be careful with the milk story, though, because milk unopposed, particularly the homogenized, pasteurized form, doesn't actually go into your bones. It doesn't reduce your cancer risk. It goes into your joints, gives you problems. But I have to give you the evidence. That's what I'm here for. I'm here to provide you with the data. The data suggests that dairy supplements, more so yogurts, has lowered the risk of bowel cancer by about 15%. Aspirin. It has been shown taking an aspirin every day for at least 5 years decreases the risk of developing bowel cancer and dying from it. Now, there is a problem with aspirin. Anybody knows what that would be? Bleeding. Bleeding. So you have to, even though I'm giving you the data, I'm giving you the evidence, you have to balance that with the higher risk of bleeding in the stomach, intestines, and brains. We don't recommend aspirin as physicians unless you have a specific reason to get anticoagulated. You have a stent or you have some problems with the heart. Other than that, we don't recommend aspirin. The incidence of bleeding in the stomach is too high. But there is evidence that taking an aspirin will reduce the incidence of bowel cancer. So, talked about risk, we've talked about what causes it. Let's look at symptoms. What are some of the things you should watch for? Etiology. What are some of the things you should look for? Well, if you have a change in your bowel habit, a recent change, looser stools, diarrhea, motions, constipation, anything that is not normal for you is a thing you should start watching at. Change in bowel habits. Going to the toilet more often for some reason. No reason you can explain it. Irregularity of bowel motions, especially if your motions have been regular in the past. So one of the things to look at is a change in your bowel habit. This is just saying, hang on, something is wrong. I don't know why. I'm going to the toilet more often, or I'm having diarrhea, or just you gotta have a watch at it. The other one to look at is a change in the appearance of the stool, because bowel cancer in the more advanced stages becomes constricting. So it constricts the bowel. So what happens is that as the stool is going through the bowel, it strings out. It becomes like a string because it is squeezing through the foramen of the cancer. So you get this narrow stool. You get mucus, which implies inflammation. Anything that says this is not normal, the shape is different, you got to watch that. Blood in the stool or rectal bleeding is a very important sign. Don't ignore that at all. Now, it could be caused by other things. It could be caused by hemorrhoids, it could be caused by diverticular disease, anal fistulas, and so on. Anal fissures, rather. But once you're seeing blood, bright red or any color blood in the stool, you ought to pay attention to it. Never be ignored. Frequent abdominal cramps, bloating, feeling of fullness in the rectum, things which you can't explain. These are things that you need to look at. No, I'm not saying that it means you have cancer if you have these things. I'm just saying these are things to watch for, and I'll show you why. Unexplained anemia. So you suddenly become very pale and anemic. They go and do your blood, and this is where your blood count, the doctor does your blood count, your hemoglobin is down, your iron is down, and nobody can explain why. That's normally an indication to have a look and see what's going on, because you could be losing blood from the cancer. The bowel cancer just leaks out into the stool. You never notice it. If you're feeling that when you go to the bowel, it's not emptied after you go to the toilet, if you feel any pain or lump in the anus or rectum, These are things that are saying, look, I better have a look and see what's going on. Everybody, that makes sense to everybody? So bowel habits, change in bowel habits, blood, tiredness, not emptying. You need to pay attention to those things. They're not benign. All right, so those are some of the basic symptoms. They are bleeding from the bottom, blood and stool, change in the bowel habit, unexplained weight loss. So that's the other thing to watch at. If you're losing weight and you don't know why you're losing weight, you're eating normally, but you're losing weight, because by that time, of course, cancer spread and it's not metabolic. Extreme tiredness because you're anemic, or abdominal pain. Some of the things just to watch out for, pay attention to, do not disregard them. These are things, do not disregard these at all. So, how do you pick this up? Because the quicker you pick it up, the greater the chance that you will not succumb to the disease. The mortality is very significant if it's spread. Very significant. So, early detection is the answer. How do I pick this up early? Well, this is one of the tests that will come to everybody. I think from the time you are 55, the government sends that to you. It's something called a fecal blood fecal immunochemistry test. It's a free home kit that will come, and it is really worth paying attention to it. Now, the problem that men have as compared to women is a big problem we have, and that's being macho. We're macho. So if I said how many of you have gone to doctors in the last year, most of us would not put your hand up. Because we don't, because we're men. Men don't go to doctors, women do. But that's our problem. So because we're so macho and because we don't pay attention to our health as women do, we don't pay attention to things that come in our door. So this comes in the door and we disregard it. But actually it's one of the early detection tests. They're looking for blood. So there's a blood stool test, and there's this one is the new one. They use immunochemistry. So even if you have a small amount of blood in the stool, this will pick it up. It will pick it up very quickly. So it's a very easy test to do. You stab the stick into the stool, and then you send it off in that little container, and you do 3 of them, and it comes back within a week. And if it's positive, then you really ought to look into it. Now, it doesn't mean you have cancer. I'll explain some of the limitations of this particular test. So it recommends that you should have one of those tests every 2 years if you're age above 45. Every 2 years you ought to be checking that out. And if you're less than 45 or less than 45 or more than false negative or false positive. So false negative means to say that you do the test and you don't pick up any blood in it, but you've got cancer. That's a false negative. False positive says you do the test, it's positive, but it's not cancer. It's just maybe a bit of bleeding. Either way, it's a good screening test. Something that will tell you, well, if I'm picking it up, I need to have a good look and see what's going on. So the first one is the fecal immunochemistry test. Please, if it does come to you, which it will, government is providing it free of charge, do the test. Do the test. Here's the other one that needs to be done, colonoscopies. So it's a quick test, it's a quick and painless test. It's done in the operating theater. You put a tube up the back passage, and you're able to see the entire length of the colon. And if there is any tumors, any polyps along the way, you can pick it up and remove it or sample it. Depends on what it is. So you really pretty much have to do colonoscopies every 5 years, just to make sure that you're not, because remember it says about a 10-year span between the beginning of a polyp to the time it becomes cancerous. You want to pick it up early, so every 5 years you should be, once you're over 44, over 45, you probably should be doing one of these every 5 years. So it's quick, it's painless. Research shows that 32% of bowel cancers can be prevented by colonoscopy. 1 in 3. It's great, isn't it? That's a pretty good statistic. 1 in 3 cancers can be prevented by doing a colonoscopy, picking it up early. And when combined with healthy lifestyle, remember we talked about the lifestyle, the meat and the exercise and so on. If you combine colonoscopies with a healthy lifestyle, you can increase the risk of prevention by up to 61%. So again, those are very good statistics, very, very good statistics. But it does show you the principle of combining lifestyle with monitoring. That's really the key. So colonoscopy is important. There are things like CT, virtual colonoscopies or CT scans or colonographies, MRIs and so on. These are generally not done, but they are done, but not as your first test. Your first line of test is your fecal test for blood and your colonoscopy. These are later stages where we're looking to see how far they spread. Can be done. So those are the sort of basic tests, but the take home there is you should be looking at your fecal test and your colonoscopy, particularly if you hit 45, you ought to be taking that every 5 years. Now, what happens if you get cancer? There's 2 cancers in that, but it's meant to be 1. Bowel cancer. Okay. Well, number 1 is they have to stage it. If, say, for example, you had a colonoscopy, they says, I'm sorry, sir, you've got cancer. They've got to stage it. Stage it means they want to know how big it is and if it is spread anywhere. Because if it is spread, your prognosis changes very significantly. Has it gone anywhere? So that's what they do. So they do blood tests, they do colonoscopies, ultrasounds, chest x-rays, CT scans, PET scans, and so on, MRI scans. All of that is done to determine how far it's gone. And they have something called a TNM system, a tumor system, where they can mark where the tumor is, how big it is, how neoplastic it is, how far it's spread, and then that will tell you how much trouble you're in. So that's one. The first one is staging. The second one is surgical intervention. If they find it, if it's early, they'll remove the tumor. So you can do it on colonoscopy. They can take the polyp out, or if it's a small, non-invading cancer, they can remove it with their colonoscopy. Local excision. If on the later stages you need bigger surgery, you'll have to have a colectomy, and quite often a stoma. You know what a stoma is, where they have the bag on the outside. So those are the advanced stages. So it makes sense getting it early so that you don't have to end up with an advanced stage surgical intervention. After that, you have to get chemotherapy. Chemotherapy is not an easy one to manage with, but it does kill cells. The problem with chemotherapy doesn't only destroy cancer cells, it destroys normal cells. So you notice when people get chemotherapy, the hair drops off, they start vomiting, they can't eat, and so on. That's because in order to kill the cancer cell, you have to kill normal cells too. So that's what you have to do to try and get a cancer that's spread. Then radiation is the other one. You try to radiate the tumor. Sometimes the tumor is so big you can't get rid of it. All you can do is do radiation for rectal cancers in particular. And now we have things like targeted therapy and immunotherapy, where you can use specific inhibitors for cells and so on, for the cancer cells. Either way, those are sort of management strategies for it, but you don't want to be going there. Does that make sense, everybody? You don't want to be going there. I'm just telling you what we have to do if you get there. Now, let's give you the last piece of that story, which is, what is the prognosis? Prognosis means, what's the outcome? What's the likely outcome? The question is, what's going to happen to me now that I have cancer? That's what prognosis means. Well, prognosis right now is very good if you detect it early. If you detect cancer early, very good prognosis. Your 5-year survival, anywhere between 55 and 70%. So it's pretty good. Pretty good statistics for bowel cancer in its early stages. But if it's metastatic means it's spread, then you're down to about 13%. So 5-year survival says, if I started off with 100 people 5 years ago, and I count 5 years down, how many people would still be alive? So 13% means 100 people started off with metastatic disease, and in 5 years, only 13 people are alive. As opposed to, if you catch it early, you start off at 100, 5 years later, 98 of them are still alive. So it really begs the question about early diagnosis so that you could be in the survival group. So, what's the take-home message? Because they told me I only have half an hour, so I'm finishing in half an hour. What's your take-home message? Well, take-home message is what? Prevention is better than cure. Isn't that right? You got to prevent it, and to prevent it, you have to have surveillance. And that is, if that's anything that I want to take home for everybody, you have to have, constant surveillance is the eternal price of good health. In other words, you have to ask a question, is anything wrong? Get my bloods done, get my stool tests done, get my colonoscopies done. It is the price, eternal vigilance is the price of good health. You know, the macho concept that men has, we have to change our attitude towards it. The fact that we don't go to doctors. If anything is wrong, we don't complain. I'm not saying you should complain. All I'm saying is that we've got to come to the point where we start monitoring our health better. Women are much better. You ask any lady, they'll be into doctors 2 or 3 times for the year already. A male, never been for years. So you've got to have surveillance, because if you don't pick this up early, then your chance of prognosis is very low. So pay attention to change in your bowel habits. That's the other thing. Or if you see any rectal bleeding, that you need to pay attention to. Avoid procrastination. Stop procrastinating about your health. We've got to pay attention to it, monitor your health. The earlier you pick this up, the quicker it is. Not only for bowel cancer, but all forms of diseases. Get your hemoglobin done. Get your blood. How many of us have done your blood pressure? When last did you do your blood pressure? How do you know you don't have high blood pressure? Because we don't measure it. So we've got to have surveillance and don't procrastinate. Take active steps towards managing your own health. So if you want to be healthy, you have to manage it yourself. You have to take charge of your health. You have to take charge of it. Don't let it meet you. You have to meet it. So lifestyle modifications, we mentioned, take-home message, diet, increase your intake of fiber and fruits and vegetables, reduce your red meat and processed meat consumption, milk and yogurt would be appropriate, and eat foods in their natural states. So, you're probably moving towards that type of diet rather than a meat diet if you want to maintain good health in general, but bowel cancer in specific. Rely more on a plant-based diet. I didn't say vegetarian diet, I said a plant-based diet. Rely more on a plant-based diet. Eat much less, what? Meat. Eat much less meat. Avoid if you can. And a plant-based diet might be your safest option for bowel cancer. Plant-based diet might just be your safest option. Yes, darling? Yeah, there's a low incidence with chicken and turkey. But red meats are a problem. So you have to avoid that. Exercise regularly reduces the risk of bowel cancer. Get regular screening, particularly if you're over 50. You need to get one of those tests done every 2 years. And I would suggest every 5 years, make sure you get a colonoscopy. You should have a colonoscopy every 5 years, even if you have to pay for it. Even if you have to pay for it. There are some new regulations, like if you're over 75, they won't do colonoscopies on the medical system anymore. Pay for it, because if you get cancer, it's a lot more expensive. So in conclusion, ladies and gentlemen, key messages: bowel cancer is significant. Do you agree with that? It is a significant problem that is being missed. It's not being spoken about, but it is a killer. There are factors you can control. You have to pay attention to the symptoms, address them quickly. Don't procrastinate. Monitor your health, take charge of your health. Screening and early detection are important for survival. If you wait until it's grown and spread, the survival is just about 13% on a 5-year basis. Not very good. And the advances in therapies now, but if you can that improve your outcome and so on, but if you can avoid having to get radiation and chemotherapy and immunotherapy and targeted therapies, you're obviously in a better place. So, we're standing at the crossroads. And if you want to be healthy, it's a change in what? Lifestyle. You have to change your lifestyle. So a lot of what we're doing is lifestyle changes as well. You have to change your lifestyle. And life is about to change. You can make the difference, either an average life or a memorable life, but the choice is yours. The choice is yours. I still like what the St. John the Apostle says, as he gave his desire for you, and this is my desire for us all. Beloved, I wish above all things that you would prosper and be in health. That should be good health, even as your soul prospers. Thank you very much. God bless. All right. Very good. Thank you very much. All right. Questions. Let me take some questions from the floor. Samuel, you had a question? No?
No, I was just sharing.
Oh, thank you, sir. That's my book. Yes, sir. Sugar, yeah. So there's an increased incidence of general cancers and sugar, and that has to do with the immune system. So the immune system is the key factor, parameter that we have to fight all forms of cancer. It has been shown that sugar can wipe out your immune system, certainly within 4 to 6 hours. You take 8 teaspoons of sugar, equivalent of 1 soft drink, and you could wipe your immune system out for about 6 hours. So if you're constantly using sugar, your immune system is depleted, and therefore, when it picks up cancers, it does not respond to it. Does that make sense? Because what protects, as I said, as I started off, everybody is producing cancer. As we sit here, we're all producing cancer. The reason we don't have it is our immune system protects us against it. So you want to do everything to support the immune system. You can boost the immune system. Anybody knows how to boost your immune system? Anybody knows what you can use to boost your immune system? Vitamin C. Vitamin C, that's external, yeah. Good diet with vitamin C. But there's a herb that will boost your immune system significantly. It's called golden seal. Golden seal. That's a very, very powerful stimulant of the immune system. Very powerful. So those are things that you have to bear in mind. But the answer to you is we should minimize sugar. You know we can't avoid it, but you should minimize sugar and things which are sugar converting. So simple carbohydrates such as donuts and cakes and candies and so on, that's basically sugar in a packaged form. So when you eat that, it converts very quickly to sugar. Certain drinks can do it as well. So again, not against drinking anything, but processed drinks like orange juice and apple juice and so on, they are very high in sugar. They can speed your blood sugar up very, very quickly. So again, you want to be careful with those use. Yes, darling? If you juice the fruits, yes. But eating the fruit is better. Eating the fruit is better because it contains the pulp. So the reason why like these juices have as I say, I'm not suggesting don't drink it. I'm just saying be aware of it, is that there's nothing to reduce the ingress, the absorption of the sugar. So once you drink a juice, the sugar in it is brackish. There isn't much sugar in that, gratefully saying. But if you drink most of the processed sugar, the soft drinks and so on, by the time you drink that is giving you a sugar boost. Do you know how much sugar is in one can of soft drink or Coke? How much? 24 to 40 grams, correct. So it's a lot of sugar. It's about 20 teaspoons. So, when you take that and you get 20 teaspoons and you drink 4 of those, you're in trouble, in big trouble. So, yeah, very important point. All right, anybody else questions before? Yes, any other questions? Yes?
So, a lot fiber is good. Fiber optics and fiberglass.
No fiberglass. But there are 2 types of fiber. There are soft fibers called pectins. So pectins comes in things like fruits and vegetables. Those are soft fibers. The value of soft fibers is that they bind things that are in the gut and allow them to go quickly. So you get good bowel motions. Now, how many times you should go to the toilet, you think? 3 times a week? So a lady came to my clinic. And I always ask about bowel motions. She says, Dr. Espinet, I have very good bowel motions. Well, I would not let that slide. So I said, yes, I understand. She said she goes regularly. So I said, well, how often exactly do you go? She says 3 times every week. But she had good bowel motions. It was good. No, it's not. So the answer to that is you should go to the toilet as often as you eat. But minimum, 3 times. The minimum, they say, is once. But that would be sluggish because normally what happens is you have what's called a gastrocolic reflex. So when you eat, the stomach tells the bowel it's time to evacuate, like a baby. Ever did it with a baby? You're feeding them and they're pulling it out in the pampers and so on. That's normal bowel motion. The problem we have is we've got training. We trained ourselves incorrectly, so that the normal gastrocolic reflex is hindered. And the reason for that is lifestyle. So for example, normally when you have your breakfast, you should go to the toilet. That's normal. But what do you do when you eat your breakfast? You're going to work. So you get in the car, you're in the middle of the M1, there is traffic, and the gastrocolic reflex hits you. What are you supposed to do now? Squeeze it in. Now, fine. Then you eat lunch, and now you have to go back to work. So you squeeze it in again. By the time you reach in the evening, your bowel doesn't work. It says, if that's the game you want to play, that's the game I'll play with you. And you get constipation. Because what you've done is you've stopped the normal reflexes. So you have to retrain yourself for the bowels for your bowel to work. So that's a very important point in terms of your diet and fiber. So those are the soft fibers, your pectins and so on. The value of that is that it removes or moves things out of the gut quickly. So to some degree, part of the problem we have is constipation does not allow the foods that we eat to be evacuated. That's why you don't see cancers in people who have good bowel motion. In many of the third world countries where they eat a lot more fiber as opposed to chicken and chips and so on, and what we eat here, their bowel motion is quick. So we have a test that are called fecal mutagens. Fecal mutagens is what are the cancer-causing substances in your stool, called fecal mutagens. When you look at a vegetarian, a person who eats a lot of the vegetarian, no, remember when I say vegetarian, I mean plant-based. Everybody is getting that? I'm not talking about eating chips and pizza. That's not the conversation I'm having. I'm having a plant-based diet. When you look at people with a plant-based diet, the percentage of fecal mutagens is very small, almost non-existent. In other words, chemicals that are left within the gut that can cause cancer because they are staying in the gut. They are lining the epithelial lining of the gut and causing that change in the cancer causing. Remember we said barbecue is cancer causing. If you leave barbecue meat in your gut, that cancer causing substance is lining the gut all the time. And it sits there for days. And so it's constantly causing the gut to change its color, change its state. So fecal mutagens are very low in vegetarians, people who use a plant-based diet, but people who are meat eaters, fecal mutagens are very high. So getting the bowel to move things out so that there isn't all of these mutagens, these cancer-causing substances remaining in the bowel is very important. That's why you must have a good bowel motion. That's really important. All right, so the hard fibers will be things like bran. So soft fibers are things like what are found in vegetables and fruits and so on. Those are pectins. Hard fibers are like bran. I don't necessarily agree with using bran per se, because bran is harsh. It can bruise the gut. I'm not against it. I'm just saying you have to be careful with it, and don't rely on bran as the source of your fiber, because it's a hard fiber. It can be quite rough on the gut, particularly people who have inflammatory guts or irritable bowels and so on. Oats is very good. If you really want a good fiber, oat, rolled oats, you get it in the supermarket. That's a very good fiber. It's very good for your bowel motion. You soak it and you have it with some almond milk or oat milk or normal milk if that's what you drink, and it can really increase the frequency of your bowel motions. All right, last, maybe one more or two more. Any more questions? Yes.
I saw that the physical activity is kind of important.
Yes. Yes.
And also when you train people to do the proper exercise.
Yes.
They spend a lot of time in the office.
Correct.
Sitting there.
Yeah.
Is there any sort of the exercise, the chance to try to...
Well, you can do things on a chair. You can do exercises on a chair. So during your lunch period, you could sit down and do the exercises on your chair. So getting some form of exercise is getting better than nothing. Obviously, exercise that's aerobic in the air, or exercise that moves all the limbs, like cycling or swimming, those are all better exercises to do. But if you're really stuck in a chair, do the exercise on a chair. You want to get about 30 to 40 minutes of exercise a day. Most of us probably not, but we're spending our time watching Netflix. That's half the problem we have. And the exercise we should be doing, we're sitting and watching movies instead, or playing with the phone. So you want to be careful with that. Make sure that you get enough exercise, because there is a direct link between exercise and bowel cancer. But I think that's intermediary through the immune system. Exercise just helps the immune system. It allows the bowel. People who are exercise have a better bowel motion because it allows the gut motions to operate. They have less obesity. With less obesity, you have a better immune system. So exercise is key. But yes, you're right. You're right, said we spend too much time in a chair. But the message is take charge of your health. That's really what I want to say. I got to spend a lot of time in an operating theater set, I know, because of accounts you spend a lot of time. We do work. We haven't got a choice. We have to live. But you have to take charge of your health. That's the point. Because nobody else will. Does that make sense? Your boss is not going to come and tell you exercise. You have to take charge of your own health. Because if you happen to get one of these diseases, then nobody else can help you. May God help you, because nobody else will. So taking charge, the message really is surveillance. Be very much aware of your own body. Start monitoring yourself, checking things out, getting tests, and take charge. Yes?
Why is it that non-processed red meats are linked with colorectal cancer and not white meat?
It's the blood.
Blood.
Yeah, the blood in it. So blood is an oxidizer. So if you take red blood, any blood, and you eat it, the body is able to take that blood and creates what's called an oxidant, an oxidizer. So it oxidizes, creates a high incidence of free radicals. So the incidence of cancer is linked to this thing called free radicals. So free radical is a chemical that is looking for something to attach to. And when it attaches to it, it causes that cell to become deranged. So free radical, for example, when people in 2 seconds. When people use vitamin C, which I use a lot of, I use at least a gram a day, 2 grams most times. When you use vitamin C or any of the so-called antioxidants, what you're really doing is providing a substrate for free radicals. That's what it is. It's not so much the antioxidant of itself, like vitamin C does. It has its role in certain metabolic processes, but the real value of it is that it provides a substrate so that the things that we are eating, instead of fixing onto your cells and causing the cell to become changed and deranged, it fixes onto the free radical, it fixes onto the oxidants. So taking free radical, taking antioxidants is crucial to protecting yourself. But it has to do with the blood. So the blood is a very strong oxidizer of free radicals. It's horrible. Yeah, yes. Coffee. Yeah, look, there's a lot of evidence now that coffee is protecting. Coffee is protecting against cancer. There's a lot of evidence for that now. That being said, bear in mind that coffee contains caffeine. So you've got to bear in mind the caffeine. So the trouble with, and there's some evidence that caffeine also protects against bowel cancer, by the way, both coffee and cancer and caffeine. But the trouble with caffeine is that caffeine can cause cardiovascular effects, can cause tachycardias and arrhythmias and blood pressure elevations and so on. So there are some moves that are looking at decaffeinated coffees or low caffeine coffees would be appropriate. But there's definitely evidence that coffee is good. No, I know we have the position that we don't drink coffee and so on. I hear that, and I think that's on the caffeine end of the story. But I don't believe God made anything that will hurt you. Nature will not hurt you if used properly. So yes, coffee. There's evidence that coffee is a protectant not only to bowel cancer but also for pancreatic cancer. But I would suggest when you're using coffee, you should decaffeinate it. That's really what the answer is. So you don't get cardiovascular effects. All right, I got to stop because everybody has to go to Sabbath school. So why don't we? I'm happy another time if the girls. Oh, doctor wants to arrange it. We can come back another day, doctor. But thank you very much for inviting me and thank you for your effort.
Well, I guess we all are so happy and feel so blessed on having Dr. Tony as part of our member and as a head elder. So I know that we don't applaud, but I feel like we deserve it.
Thank you very much.
I was amazed because I was in the kitchen and I was looking at your faces and you were so concentrated, and I really appreciate.
Thank you, Doctor.
We have a wonderful day, and
Yes.
we say thank you to you for the effort and all the knowledge and information that you have
Thank you very
provided,
much.
and the love and the passion that you put on it.
Thank you very much.
Thank you for coming, and we wish you all from the health department a good Father's Day, and that you enjoy it with the family and you feel loved and blessed. And remember our Heavenly Father, that He is the one that provides, and He is the one that is in control of everything that happens into our life. Even the bad thing, He is also having the control and He's in charge. So we're gonna go with the hope and the love, feeling that our Father is overlooking us. Could you please pray so we can
Yes,
close?
thank you. Let us pray. Father, again, we thank you for this knowledge you give us so that we can protect ourselves, because your desire for all of us is that we should prosper and be in good health. But we do need to take charge of our health. So we thank you for the knowledge. We thank you for the wisdom. Help us now to accept it and to implement it. For faith without works is dead being alone. Help us to work this knowledge so that we can be healthy and we can be good examples of your people. And we thank you for this blessing. We ask for your healing upon your people in Jesus' name. Amen. Thank you very much. God bless you all. Thank you, Doctor. Now, can I ask you a big favor? If you could put those chairs together. So I'm going to need some help just to put some chairs down so we could start. Or we could just keep actually, we could keep the tables. Yeah, people would just talk around the tables. That's right.